Good afternoon, everyone. My name is Sue Parr with the Augusta Metro Chamber of Commerce, and thank you so much for joining us this afternoon for today's program of our Achieving More Together Today virtual web series. We are honored today to have Dr. Mark Newton, our state representative from Georgia's District 123, as well as CEO of MedNow Urgent Care. He is also a physician at Doctors Hospital. And Dr. Newton, we just so much appreciate the opportunity to have you with us this afternoon. You're going to be discussing the outlook for COVID-19 testing and its potential role as we start to see this return to work here in Georgia. And I think you also provide a very unique perspective as a member of the Georgia General Assembly to talk a little bit about how state leaders are really going to be measuring the existing and future conditions of public health and economic health, and how Georgia will continue to best recover from this pandemic. To our participants today, again, this is part of our ongoing webinar series that we hold every Tuesday and Thursday as part of our goal of keeping our 1,258 members engaged, informed, and above all, connected. As we know, in this time of social distancing, it's very hard to stay engaged when we can't be together, but we are together virtually. We also hope that you're getting our daily email communications and you're checking out our social posts. We want to make sure that we are continuing to be a very relevant source for actionable information for your business. And we are there with you every step of the way until we are completely free of what has disrupted our economy. This webinar will be recorded and sent to all of our participants that are joining us today. It will also be posted on our website, as we have for the last 8 weeks. We have posted all of our recordings on AugustaMetroChamber.com, and we've accumulated now, after today, 15 webinars on everything from how to lead and manage a remote workforce to the difference between essential and non-essential workers. And of course, today, as we start to move into that return of work phase, we are very pleased to bring you this information on testing and how we move through this transition. So if you do have any questions for today's webinar, and we highly encourage you to share your questions, there is a question box on your screen, and all you have to do is type us your question, and that will be viewed, and we will be discussing those with Dr. Newton. And again, thank you very much, Dr. Newton, for being here today. I will stop there and turn the webinar over to you. Thank you.
Thank you, Sue. I am glad to be here today with all of you that are joining, and somebody joining later, that's fine too. That was a little ambitious, the title about the path to both physical and economic health. It's certainly, I'm sure the calls will be coming in once they find out in 20 minutes I have all the answers. But obviously, that's not true. I don't have all the answers. What I do have is a seat at a place that maybe is a little different viewpoint than a lot of people that are out there trying to run a business, trying to go back to work, trying to figure out when is it safe to go back to work, how do I take care of some of my valuable employee resources. So that's what I'm going to touch on a little bit today. I do have a couple of different roles. I know a lot of people are out there learning different roles. Maybe you're learning the role of teleworking and like me, just wearing something from the waist up. Trust me, I do have on slacks. But I know a lot of people are out there trying to learn about teleworking. They're learning a new appreciation for their teachers and teachers' assistants that are out there learning how hard it is with a first grader or a seventh grader, especially once the math passes beyond what you can do yourself, trying to be a good teacher for kids that are home for school. Everybody's got different roles. I have a couple of roles. I'm honored to serve, as Sue mentioned, I'm honored to serve in the House Legislature, the Majority Caucus Chief Deputy Whip. I chair one of the health committees. I am on one of the governor's task force to study the coronavirus and its effect on healthcare and other areas. So I do have a seat, and I'm listening to the different people, trying to represent our area well, but also give a perspective that's somewhat unique. I would have said yesterday, but actually at 1 a.m. this morning, I was in the emergency department taking care of patients, just like our whole team there does, and what I've done for over 20 years. It's a great team, great people out there. Certainly what I would call some of the front lines on figuring out how we appropriately take care of people, both patients and coworkers. So I've got a role as a physician. I do have that role as a business owner. Sue mentioned MedNow Urgent Care, which we'll touch on that. So that's one viewpoint as a fellow business owner, a fellow coworker with others with a business in the greater Augusta area, like the Metro Chamber. So ably represents and gives us great information to come along. So I do have that. And then the final role, obviously, that Sue mentioned is this role in policy. And I do want to make a little bit of a difference between my role as a physician and my role as a policymaker. Both of them, in particular, the physician role does inform the policymaker decision, but sometimes those two roles can have different effects. And I think that's one of the things we're seeing, and I'll touch on briefly about Governor Kemp and the rest of the leadership who have to listen to not just health people like me or someone else in public health or something like that. They need to listen to others, including you, people with businesses, people with coworkers that are trying to get back to work. So I'm going to touch on that real quick. Would like to start off in my role as a physician. The CDC recommendations are certainly a wise and strong place to start. They're well vetted. They come with certainly strong recommendations, and I know a lot of people know these. We'll just touch on a couple of them. Everyone knows the hand sanitizer, the hand washing, how to sanitize a workplace as best you can. Stay home if someone's feeling ill. Some of these are the ones we try to get people to do even during flu season. Social distancing as much as it's possible, no large gatherings. There's several good sites for what I would call the current guidelines for how to keep you and your family as well as your place of employment safe. And I certainly would encourage everyone to familiarize yourself with those. I do know when I was looking over some of the guidelines for restaurants and other things that were the first, they were the first to be closed by government edict or law. They were also the ones that the governor opened first, since he could only open the ones that he had closed. But I know there was a list of 39 things. Well, of course, in my field in healthcare, which wasn't ever closed, but for example, there is no social distancing if we need to take care of a patient. A nurse taking care of a patient, there's no 6 feet between the IV needle and the arm that's being put in. So a lot of those 39 wouldn't apply to every business, but I would encourage every business owner and really everybody who's going back to work to look at those to see which ones are appropriate, which ones can you do. I've seen more and more people get more and more creative with ways to do and ways to keep themselves and keep others safe. So I think we're seeing that more and more. I remember early on, a lot of the hand sanitizers, even now, a lot of them require you to touch the hand sanitizer every time you want to use it. And then after a few years of us doing that in the hospitals, somebody came up with the motion detector one. So we no longer have to all put our hand on the exact same sanitizer to clean our hands. That was just during regular flu season. We'd encourage that use over and above hand washing. So I think the ingenuity of people will come up with more and more ways to make some of these things that are a little cumbersome to begin with, will make them much more user friendly, make them make more sense, and be just much more accessible. I did say current CDC guidelines, I think, because this is a fluid situation. If we've seen anything, we've seen from December to January to mid-February to late March and even to now, how different the data is that we have, especially data I would call strong data. And that's the next thing I think we need to, as a physician, I think we need to prioritize rigorously vetted data. There are lots of case studies. I certainly understand those can be of value. They can tell us a place that it's better to study. There are some things that can't be rushed, but what we do want to do, and what I was mentioning about the CDC guidelines, is the current guidelines may change. Matter of fact, I'd be surprised if they didn't. I know one of the things that came up was whether to close a beach or not, even for exercise. Some were closed early on, and some were opened back up when it was kind of recognized that jogging or walking on the beach was really probably not a high risk activity. And so I think we're gonna get new data as we come along. Doesn't mean anybody had ill will either direction, opening or closing, but at the same time, what I think it means is that if we're wise in how we approach this as policymakers, we will change our mind sometime. We will change our recommendation, because new data should do that. It should lead us to improving our answers and not going with just something because we said it 2 or 3 weeks ago that we have to stay on it now. So CDC guidelines are a good place to start, CDC current guidelines, prioritizing the results of rigorous studies. One thing in particular you'll hear a lot, and when I touch on testing, but anytime you're talking to anyone about testing, antibodies, all the different things, there's a couple of phrases. There's approved and authorized. And while they sound similar, when it comes to the Food and Drug Administration, they're very different. FDA approval has been the standard for medications and new treatments and even implants and things like that, as far as hips and knees and things. They require a very strict approval process. One of the problems is the approval process takes a long time. It requires sometimes multiple studies, multiple repeats of the study, maybe a change and then study it again. So the FDA approval process is very rigorous, as it should be, before we say give something to our child, even for their fever, or give something to an elderly individual for maybe a symptom of Alzheimer's or something like that. The approval process is rigorous and it's time consuming. So that's approval. What separately there is there's the now authorization, which sounds very official, but EUA, which is emergency use authorization, many of you probably know this, but that's where we are with a lot of the testing that's being done now, whether the testing for a virus, especially the quicker studies that we'd all love to have, one that comes back in 15 minutes like your flu swab, we'd love to have those. It's very hard to get those, especially for antibodies. So a lot of them will say FDA authorized. And what that means is it's gone through kind of a mini approval process, I would call it. It's gone through maybe a very small study, maybe a couple that were maybe not what we call the statistical power that you would want in a study. Maybe it didn't have all the right avenues for a double-blind study, so it was controlled. But there's evidence for the item that's now has emergency use authorization. So you will see a lot of tests that say FDA authorized. And that's a separate set. I know it's in the weeds a little bit, but it is important when you're looking at different options and wondering, why don't we all do just that oral test that comes back in 5 or 10 minutes for a virus, for example? Well, there's a reason, is because some of those haven't been as rigorously studied as we'd like, especially if we're going to tell somebody they're negative. We really want to avoid false negatives, ones where people can go back and spread this after we've, in science, have given them kind of a clean bill of health. So recognize there's FDA approved and FDA authorized. And then finally, in the testing realm, in my role as a physician and how I look at this, and believe me, there are a lot of individuals, both in the greater Augusta area and across the state and across the nation, frankly, across the world, that know far more about all the testing. But the testing, I'll just split it up into two big categories. One is the test for the virus, and that's the test that looks usually for the genome of the virus. There are different levels of what it takes to turn one of those tests positive. So there's different ones, some approved. Some of the ones that are approved take a little longer and have to be sent off to a major lab like LabCorp or Quest, or even a central reference lab like Augusta University. But they may take longer than the quick tests that might be done in a doctor's office under what's called a waiver process that can be done quickly and read by a medical technologist or a physician or a nurse. So those are the tests. You've got the test for the virus. That's the one that will tell you that you have signs of the virus, that you have, even if you don't have any symptoms, it can be what tells you that you have an infection and you're contagious. The second one would be the antibody test that we're all hearing about. I know at MedNow, if I put that hat on, we just started this past Monday doing antibody testing on people. We certainly in this area have lots of healthcare workers. We're blessed to have multiple hospitals, all often great in their own little area or even in many different areas. But they've got a lot of healthcare workers. We got VA, we got an Army hospital where I used to work out at Eisenhower, of course, Doctors University, Augusta University. We've got all those healthcare workers, and a lot of them, like me, may have wondered, I wonder if one of this patient I had in February, I wonder if I could have been exposed, and now I was one of the ones who had either mild symptoms or maybe even the group that never had any symptoms. So antibody testing is something that will tell us what the exposure is, whether or not an individual has been exposed, but it'll also tell us whether they're likely to have immunity. That's the IgM and the IgG. The IgG, just remember the IgG is the good one. That's the one that we think may confer a certain degree of immunity that lasts. No one knows, as Dr. Fauci even has mentioned, no one knows if that's immunity for 3 months, 6 months, a couple of years. I know with hepatitis B, for example, or some of the different hepatitis vaccines, you get a titer done. You get a kind of a number test, not just a yes or a no, but you get a number, a level, and if you're above a certain level, they think you're pretty much immune to getting that again. And so it may come to that at some point that we have tests good enough to give us a number for how good our immunity is. So those antibody tests are out there. One of the little problems with that, or a couple of things, while they're not a nasal swab like the test for the virus that I mentioned, they require a blood test. And in our case, we send it off to a lab that does it under an FDA authorized antibody test, but a very well vetted one is what, even so, because the FDA doesn't want to have us take the long time that it normally takes for the real approval process, the full process. We are asking them to go, as soon as they have some good information, to go on to let us start using this, because time is of such an essence here. So that's the overview of the testing. Is the viral testing is the one that tells you whether you have it now and whether you're contagious. The antibody testing tells you, have you had it in the last, say, 3 months? Have you been exposed and either had it or thought it was the flu or thought it was just a sore throat, strep throat, something like that, and got over it? It would let you know if you have immunity. One of the other two things about immunity that I'll mention, when the testing was done in some of the hot spots, and matter of fact, it's been done what we call serology, which is looking at those antibodies, finding out how many people have been exposed and exposed enough to have developed an immune response to COVID-19 or to the coronavirus. I know in Stanford and in Los Angeles, there were a couple of studies just looking at how many people had been exposed. And then the most recent one I read was in New York. And it showed that even though the study I read said that about 14% of the people had antibody to this coronavirus. And so by having antibody, what that told us is the disease was much more widespread. What that does, when we all put on our public policy hat, that tells us that that the mortality rate, because we're pretty much sure about the mortality. We know there's death certificates, there's studies that are done. We try to make sure, even though there is some confusion if someone has both lung disease and renal disease and maybe liver disease, and then also has this respiratory illness. If there's a death, we're sometimes not positive which was the actual cause of death. It could have been any one of the four or some combination. But anyway, we do know the COVID-19 deaths. What happens is if the exposure rate is much higher, we know that the mortality is lower. That'll come in at the end when we talk about how do we make policy decisions, because knowing the mortality rate, especially if we can divide it by certain age groups or certain risk groups, let's call it, that can mean that maybe there isn't a one size fits all for every person, from a pre-K student to a college student to a senior citizen to a retiree. May not be that one size from a policy point of view is the wisest choice for getting things back in order. Let me just touch on this as a business owner, and a coworker with a lot of individuals at MedNow Urgent Care. I heard a comment today. I was on a call with a group from the Capitol, and someone was having an issue with just calling people workers. They just were pointing out how little that does to really explain. These are not interchangeable items. These are things that you may have gone through an exhaustive hiring process, spending a lot of time interviewing different people, finally finding the right fit, putting together the right training program to where they could be maximum benefit. They may have gotten several promotions along the way. because they just really excelled at providing whatever your business does to excel. And I know I work with people like that. I think just implying that they're workers is, and I'm not saying that anybody's really doing that. It was an interesting comment, a reminder to me as a coworker for a lot of people, is that there's a lot of effort, and when people want their individuals to come back to work, it's not just anybody to fill a spot. It's someone, they want that person to come back to work. They'd like this individual or that individual who was really perfectly promoted into a certain area to be the one that comes back. So they want them to come back, and they want them to come back safely. So I look at that and recognize now the question is, how can we safely move forward and get these team members, these associates, and get them back to work? How can we do it wisely? Well, like I mentioned, we do have the governor's guidelines, those 39 that I mentioned, not all of which make sense for everybody, but minimizing shared tools. I know sanitizing is pretty much across the board, trying to find out how to sanitize your workspace and your work area. We've all seen a lot of the plexiglass shields that are being they're just, I say manufactured, but there are a lot of people are just making it up as we go, because we're learning new information and we realize, hey, that might be a great way to protect, say, a cashier or maybe two coworkers who on a machine need to work close together, maybe closer than the 6 feet that you'd like, but maybe a plexiglass shield is an innovative solution. Every business is different, but we all do have the same goal. The goal is a safe workplace for us and our coworkers. But I would say it's even more than that, because I think it's also got to feel safe. I mean, before we can take care of others, we need to feel pretty confident ourselves. Early on, you may remember back in March, there was a real fear with a lot of us in healthcare is having enough PPE. Everybody's heard that till they're tired, but personal protective equipment, it's kind of like we're out there taking care of either trauma patients or patients who aren't breathing or having a seizure or having a heart attack. It was a very important thing for the hospitals, and I think they did a great job, and the state worked with them. It was to get the personal protective equipment to us so that we felt safe to go. And then, I myself, we go into rooms where we suspect a patient may have COVID-19. Now we're going into ones where we know they're positive. We still go in with a certain caution, but we've got a great team that can do it. We have the equipment to do it safely. So that's one of the things I think all of the businesses out there want to find out. How can we make ourselves and our coworkers not only be as safe as possible there is a reasonable standard, but to come back to work, to be as safe as possible, and then to also feel safe. I think that's the way to get people back to work and productive. And then as a business owner, for those that are business owners, you want to know that that you've done all you could. Nobody's expecting a miracle, as if we remember the flattening the curve. If you remember, there was a line that was our healthcare capacity. That was a point at which we ran out of ICU beds, we ran out of ventilators, we ran out of the ability, like we saw over in parts of Italy, where it seemed to be just a crisis and maybe even a poorly managed one, and the curve would go up exponentially and then come back down. And all those above the curve would mean, I might have breathing problems, or my family member might have a breathing problem. Well, the hospital's not able to help me. Viruses like influenza or some others, there's not a lot of medicine we give for it. What we do is what's called supportive care. We try to keep things, well oxygenated, keep your blood pressure where it ought to be, cardiovascular, respiratory. We try to keep your kidneys and everything working well while your body fights it off, because that is the way we get rid of any viruses, from a cold virus to SARS to influenza. There's not a lot of medications that do a great job. Your body fights it off. So what we were worried about with the curve is it was an exponential curve that would go far above our capacity to take care of people. And flattening the curve was the model to do that, to make sure that we never went above that capacity, that healthcare capacity. I think we've made good steps in that. We may have even overshot, but that's a good problem to have. But I know there's centers that have been built and stood up in record time and then not even being used, which is good to be prepared. Obviously, it's not without any expense, but it's good to be prepared. And so we've seen how to do that. We've kind of practiced it in the same way we in our areas do radiation drills or mass casualty drills, as if there was a plane crash. We do those jointly among the emergency departments pretty regularly now. Well, we now know what it means and what it takes to ramp up an auxiliary ICU, or maybe ICU is not what you need, but you need a safe place for nursing home patients to go once they've been diagnosed with COVID, so they don't go back to the nursing home and spread it. So we've learned a lot on how we can do that better. I think we've flattened the curve. Now it's a matter of how do we move forward. As I mentioned, with my MedNow hat on, if I could change jackets if I needed to, but I'll keep this one on. I do want to say one of our goals since 2009, and we do have a great team there, and everybody's been working basically full time since all this started, and a lot of them doing overtime. If anybody's been to our drive-through testing site at the Columbia County Exhibition Center, got a great team out there doing that, giving a safe place for both our staff to help people get better and get information, but also a great place to be able to offer something convenient right off exit 190 there, the exhibition center. But we've been, our goal has been to provide for patients, since 2009, since we started in Columbia County. It's several 100,000 patient visits since then. And then we stay open till 10 o'clock at night, 7 days a week. We don't do that because we didn't have anything else to do, or we have employees that don't care to eat dinner with their family. What it is just like a lot of us in healthcare, and so many nurses that work night shifts, and CT techs and respiratory therapists that do night shifts. That's just part of the nature. And so what we've tried to do at MedNow is offer an alternative to both individuals and business owners, to where they have another option other than coming, say, to see somebody like me in the emergency department for something that maybe they know is not an emergency. It's just a broken hand, or it's a small laceration. Maybe it's something that needs an injection. Well, one of the things we do as a team is pretty regularly look together. So as this started, our management team kind of got together and said, well, what would businesses out there want? What would make them more comfortable? What might be of value to them? In the same way, keeping a doctor available till 10 o'clock at night without having to go to the ER is of value to a lot of people. And one of the things we realized was testing might be. So that's why a couple of weeks ago, we started just testing everyone. In particular, we were wanting to have an option for restaurants and all those businesses that were going to be able to open in close proximity, maybe to give them an option on how they could make sure nobody's contagious, at least on the day they go back. Certainly there's a limitation with my medical hat. There's a limitation that just because I'm negative today doesn't mean 4 or 5 days from now I might have been exposed tonight and now I'm contagious a week later. No testing is perfect. We don't have a good answer for serial rapid tests just yet, but I do think we've made a lot of progress in that. So we're seeking out ways we can be a business, a help to a business. We know that so many owners and so many HR representatives, they aren't looking just for the minimum. And I would say the minimum is probably following the guidelines that I mentioned, both CDC and the governor's coronavirus task force guidelines. Those are going to be expected, and as much as you can. Once again, remember, I can't do 6-foot distancing in my job. And there are many other jobs that can't do that, but many can, and many can do other things. Many can wear gloves, many can sanitize. Almost everyone can sanitize. So following those restrictions, we decided to also offer, for those who wanted it, we do on-site testing to see if people wanted, especially if you're bringing employees back from a lot of different areas, we wanted to make sure that you, at least if it would make your employees be reassured, take one of the worries. Everybody's got a lot of worries. They're worried about what do they do with their kids who are still out of school. What about their finances that may have taken a hit? What if they're still waiting on their unemployment check, but they want to get back to work? One of their worries might be, is it safe to go back to work? And so we offered that, and we still offer that. We do site visits for certain size companies if they want. Great thing about the Families First Act passed on a federal level is that there's no copay or deductible for either the doctor or nurse practitioner you talk to, or the cost of the lab test. So there are some there are some options out there. That's one of the options, just with my business hat on. And we did just start this past Monday, starting with offering the antibody testing as well. Some are more interested in that. I would point out that the antibody testing won't tell you whether you're contagious. You know, if I was contagious today or Sue was contagious today, her antibody test might still be negative if she was, say, pre-symptomatic or asymptomatic, or one of us was. So if what you're wondering is what's the odds of come Monday or come the day or two later when the results are back that somebody could be contagious, then you want the viral test. If you want to know if some of your people have immunity, especially in the healthcare field, or family members that have been had, you know, kind of questionable symptoms, and they wonder if that's what they might have had, that's where the antibody test can also be of value. So those are the two kinds of tests. That's my MedNow Urgent Care hat. I will say one last thing about antibodies is, and I know we've had an outbreak at Plant Vogel. I'm sure there's other places. There's some workers. The antibody tests, or people who've been positive, what I would love to get out is that we do think that antibody, and especially if it's concentrated, can be part of the treatment for this, that may reduce the mortality. We've all talked about the potential for a second wave during flu season this next year. We certainly hope that won't happen, but at the same time, I don't know many people who would want to bet on that not coming back, not ever having especially if we hope as it dies out in the summer like influenza does, or similar to that, then we hope that if there's a second round, we're better prepared. One of the ways I think we could get better prepared is if the individuals who have the IgG antibody, the good one, remember, if they have that, if they're willing to donate, and I know I went to a ribbon cutting over in Martinez at BioLife Plasma Center. They've got a great factory actually between here and Atlanta that I've been to, a company called Takeda. They're part of a plasma treatment conglomerate, or it's a group that's together, that's been coordinated to look and see if getting this plasma, separating out the immunoglobulin or the IgG, concentrating it, cleaning it in a way that it doesn't require you to be matched for blood type. It can be given to anybody of any blood type. So a lot of great things about it. It's a great Georgia company. It's their best plant in the world over in Covington, Takeda. And so I'm hoping that people who've had this, who've tested positive, or maybe one who finds out they have antibody on their antibody screen, can be part of the solution, maybe part of keeping America from having to shut down again in January. So I think we ought to reward those people. I'm excited about that opportunity to find out if you have potential exposure, and frankly, if you do, as quickly as you can, see if you can donate it. It's not a commercial, but I do know they give $200 for the first donation and for the second donation. So yeah, I know a certain amount of people, especially if you've been out really with COVID-19, a couple of weeks after your symptoms are done, there's a couple of $200 checks and a great big thank you from the rest of us. If you'll help them get the studies going to where antibody may keep America from having to shut down again if there's a second phase. I'm going to just touch real quick, Sue, if it's okay. I'll touch on my policymaker hat. I am honored to represent this area. It's an incredible area. Everybody knows it across the state, frankly. We've got the state's only public medical school. We've got some hospitals for this entire region, and over into South Carolina as well, that are just known nationally for the work they do in taking care of people. So in those roles that I mentioned earlier about the coronavirus task force of the governor, also on the task force from the speaker to figure out how to open Capitol Hill back up in Atlanta. What's the safe way to bring people? And frankly, I have coworkers there that are over 80 in great shape, but they're over 80. We have people in their 20s. So we've got largely different risk groups across that spectrum. I know we have some that have cancer, some have family members on chemotherapy. Some, as I said, have cancer or getting chemotherapy themselves. Most people keep their information reasonably private, but we know that's the case. So we're going through this almost in the same way I know a lot of the employers out there, or HR representatives, trying to figure out how do we open safely and open back up. I do know we have a couple of things on this reopening that I think we have to keep in mind. We're going to try to do it safely, but the final thing though, we'll work with the Georgia Building Authority and the minority and majority leader. We're going to make this bipartisan. Make sure we have all the staff that support us. None of us do our jobs by ourselves, and so the staff that are so important in communicating with you guys as well as your industry representatives and things like that are key. I know we're looking at the temperature screening devices. We certainly want to identify the vulnerable, that, as the governor has pointed out, the medically fragile or elderly that have seen the brunt of the mortality. The rate is so vastly different from those under, say, 40 or even under 50. I am going to just touch real quick on a quote that I think we have to look at when it comes to our policy role, though. And this is a little different. This is not necessarily my public health degree hat or my doctor degree hat. This is more in the policy making, recognizing that, and my wife will tell you, we don't like the word essential worker, because if somebody's out there providing for their family or trying to help their kids get educated or make a future for their new spouse, or frankly trying to get married, essential is kind of in the eyes of the beholder. We know there's some that every job is essential to the person who appreciates that paycheck, the people who it helps support. Frankly, we're going back to do a budget because, like it or not, we know that the budget will be vastly different when we go back. We're going to have to redo the one we did in March because we know it's not realistic. But that budget takes care of the health care of 2 million Georgians, lots of individuals in nursing homes, the vulnerable among us, clean water, clean air. It educates our children. And I'm talking about K through 12 and above that are so important to the Georgia, not just surviving but thriving. And so we're anxious. We're not hoping people get back just for the money, but we do recognize those programs. We were looking at cutting 4% and 6% earlier, and we're really worried about the vulnerable. How do we take care of them? And now we've got to go back and look even harder as people aren't working and they're receiving benefits instead of paying taxes. So we know just across the board how badly people want to get back to work to take care of their families. So that's what this quote is. This is a doctor, or Professor Paul Dolan. This was in the Spectator a week or two ago. We know that people care about all these things. It was talking about mortality. We care about our family's health, and people are willing to make various trade-offs between them in their daily lives. But it's simply not true that they care only about health or mortality. In the current lockdown, many people would willingly put their own health at risk to be able to see their grandchildren. I know we got Mother's Day coming up in a few days, or to attend the funeral of a loved one. As citizens too, we want resources allocated to reduce mortality risk, but we also care about mental health problems, addiction, domestic abuse, and child abuse, all of which are showing early signs of increasing during the lockdown. We also care about the effect on job losses, educational outcomes. We know it can't be good for a first grader to miss a significant part of their first grade or their second or third. We know how valuable those teachers are. We care about the effects on job losses, educational accesses, and widening inequalities in income, life expectancy, health, and well-being. This is the final line. There comes a point at which the economic and social cost of a lockdown become too high a price to pay for a reduction in mortality risk just from COVID-19. I'm not saying everyone's going to agree with that, and it's easy to say. I know when I'm sitting here healthy, or you're probably feeling fine if you're watching this. I don't want to belittle that. I want to make sure that we have the capacity, that we never have that exponential growth that gets above our capacity to care for people. But I do think we need to keep that as policymakers in mind, that while families care deeply about their family's health, they also care deeply about their family's economic health, and their financial security and financial health. And so we're going to work hard to balance both those. We want to be wise with the way we look at the health side and the health risks, and all the other things that are out there that are risks, whether it's fatalities from transportation or driving, or fatalities from other illnesses that are still going on. We want to certainly balance the need and the desire to get those as close to zero as possible, but recognizing we will probably never get them to zero in those other areas. As we gradually look at and start to hopefully round the corner on the COVID-19 pandemic, hopefully we can look at that. We can come up with maybe some treatments that will lower the mortality. Maybe the mortality is even lower, as New York and California have shown. I think if we keep in mind all those things, we can help get you and your coworkers back to work, providing for others, providing for your families. And I'm certainly open to questions, comments, and recommendations on how we can kind of, with the policy hats on, how we can balance not just health, but also a family's economic and financial health and security. So, Sue, I'm sorry if I went on a little long. I'll
Great. That's
certainly
great.
open for any questions, and if they want to send them anonymously, I certainly understand.
Well, and I would remind all of our participants, if you do have a question, to click on that little question mark on your screen. So, Mark, I'll kind of start us off because I think there is a lot of interest in the antibody testing. And I know you said it's just FDA authorized. It doesn't tell you how long you would potentially be immune, if I understood you correctly.
Right.
So if someone is interested in the antibody test, do they have to share with you in order to get the test that they felt like at one point they had symptoms, or what's your protocol for administering that test?
We've had some great lab partners over those 11 plus years that we've been that we've been open, and we have multiple of them, which is helpful at times like this. So we have lab partners that'll do the test that we send. There's not it's not one that has the lack of reagent or the swabs that are having to be made by 3D printers and things like that. The antibody test is pretty straightforward. It's a tiny little butterfly needle, if y'all have seen those. We draw a tube of blood and we send it off to the lab. We obviously make sure we have the history ahead of time that might be important, any other illnesses to consider, any symptoms that are going on. So we have a brief, usually just a telemedicine visit with someone. We do try to get people to sign in online or do it. If it's a company, we'll do it kind of as a group where we get their information and all the contact information. And we're certainly responsible to keep up with that information properly, to get the test to the lab and then the results back and the results to the patient. So we can do that, and it does not require you to have had symptoms or to have known you were exposed. We know people are all over the place and their risk factors. As I mentioned, for the legislature, we have people, from one end to the other on risk groups. And by the same token, people are like that when it comes to information. Some want all the information they can. They have important things to concern. Am I safe to go visit my great grandmother? Is it safe to travel or whatever? Everybody's life situation may be different, and so we just kind of recognize that we're a service industry, like so many of us. We're here to try to figure out to offer what might help your life, whether it's get you healthy or keep you healthy or repaired, or in this case, give you some either peace of mind or some knowledge that, in particular, if you're able to help others by donating plasma, that would be a great reason to get it. And once again, it's not free. I don't use that word because I understand everything does have a cost, but it is no cost to the patient in a way to do that. And so we have a way on the MedNow Urgent Care.net website where people can sign in online and they can say what they'd like to do. And the good news about that is you can sign in online. You can wait in your car. You don't have to go sit in a waiting room. You can be all registered, and all you do is kind of come in a special way. You go to a special room and we draw your blood and send you back out, and you're never around anybody very long. Everybody obviously takes all the right precautions, both for our staff and to keep from being a potential contagious person with the patient. So no, it doesn't require symptoms.
Mm-hmm. So a lot of our manufacturers here in the area have had to continue operations because, and I know you don't like that word. Every worker is essential. But they have been in continuous operation, and they have obviously adapted their facilities according to all the CDC guidelines. And in talking with them, some of them are actually just going to continue to do what they've always done. because they really don't not sure, what they can pivot to. Some of them, if you work there, one of the first things you do is you have your temperature taken.
Hmm.
And, so I think for a lot of, especially manufacturers where you have a lot of personnel, you do have sometimes those situations where people are closer together. It is of high concern for them. Do you see, an opportunity for some of these facilities to start thinking about, testing their workforce? I know this also goes to another issue of, right now employers are largely, free from liability because of, the situation that we find ourselves in. And I know this is a policy issue that the Georgia General Assembly will be discussing, but, what would be your potential 1, 2, 3 pieces of advice for a manufacturer right now?
Well, you do bring up two different considerations is the current pandemic and emergency order. There are some liability protections for certain fields, but not all. And that is something we do want businesses to open back up, not just because it's not some love for business, it's because people need their jobs. And if there is no, we've talked about Georgia being #1 for business for, I believe, 7 years in a row. And every time I hear it, I want to add "and jobs," because if you're out there, if anybody remembers what it was like to be unemployed back in 2008 or 2009, they realize what a blessing having a job is, or frankly, even better, having 2 or 3 jobs that would like your services, and you get to kind of pick and know that you have options, your kids have options, things like that. So I do think it's important that we get people back to work. I think that some of the people, I mean, people do need to follow the guidelines. We would love for the businesses to have some protection, that if they were making a reasonable effort for the guidelines that I mentioned, those 39 potential guidelines, and there may be others for other industries, as long as they were trying and showed kind of a good faith effort to follow as many of them as they could. It would be nice if class action lawsuits didn't cause them to shut down or to not bring people back, or just find it better just to close the business or declare bankruptcy or whatever. We certainly don't want to push businesses into that. And so we think that a certain degree, I mean, I haven't discussed this with my leadership at this point, but I think a certain amount of protection so that people can safely follow the guidelines. And remember, I said those were current CDC guidelines or current Georgia Governor's Task Force guidelines. Those may change. They may get, they may relax in some area, they may get tighter in another area. The contact tracing will help inform that as we find out where are these cases and illnesses coming from. So I'd like for them to have the protection to just do a good, reasonable, good faith effort to follow. Second thing, though, one of the reasons, once again, with my MedNow hat on, is there are some businesses that are trying to think of not just what's the minimum or what's the best practice, but what is the most I can do to not only try to be safe and follow the guidelines, but to just try to make my employees more comfortable, make them feel more secure as best we can with the limited testing or limited resources that are out there. And so that's one thing. But I do think the protection on a state level is very important. That won't happen overnight. We're not even back in session formally, and even though we're starting to meet again, we aren't even back in session until June 11th. Take somebody wiser than me to explain whether or not the governor can make an exemption that outlasts his emergency powers. I'd have to go to Barry Fleming or one of my other representative friends to get that answer. But I do think that's going to be an important thing. In the meantime, I think the manufacturers, they've got some guidelines they can go by. I would probably have a real as close to formal or at least a written policy. I've even raised the question, all right, so if somebody says nobody with a temperature, that's fine. But what if they say you're supposed to wear masks or wear gloves, and then somebody doesn't? Do you fire them? Do you reprimand them? Do you send them home? And if you don't do the worst of those, are you somehow negligent because you didn't fire everybody who took their mask off a little too soon before lunchtime. That's the kind of thing where we don't want, I mean, manufacturers in Georgia were already looking at the challenge of, I won't call them all frivolous lawsuits, but at least the exposure they have to where even a lawsuit that you win is not really a win because of the cost and the bandwidth and everything else that it takes up. So I'd like to see us work on that. I'd like to see the manufacturers, have a written kind of a reasonable effort of the things that are reasonable for their business to follow. Certainly there's other options for those who'd like it.
Mhm. Can you share with us, I know we hear a lot about herd immunity. Can you talk to us a little bit about how you view that? Is we hear a lot that is going to be a good thing. Do you see that in our near short-term future, mid-future?
Yeah, the best reports I've seen on herd immunity really talk more about 40, 50, 60%. We know we try to get to that with influenza, with a vaccine every year. I do look at this, once again, with my policy hat on, is informed by my medical background, is that there's a chance we won't get a vaccine that really works. We've got a vaccine to influenza, and I know the viruses are very different in different families, but there's no guarantee we're going to get a vaccine, and definitely not anytime soon. It could be years. Even then, the vaccine may be more like the flu vaccine, which I got last year. We started with one, and then it was a double, and then a trivalent, and then quadrivalent. The 4 vaccines together are what we're giving now. Even with that, a couple of A's and a couple of A and a couple of influenza B vaccines put together, I still got the flu in January. So we know that the vaccines may be difficult to develop. There probably will not be universal. We don't know enough about herd immunity. Obviously, it takes some people who are immune, having a known exposure. That's going to be a tough one to prove that it works. I do know, once again, there's a great Washington Post article about, and I don't say that a lot, but it was a good article, a diagram that showed the effects of quarantine, and say if we tried to quarantine in Wuhan, China, and just 1 or 2 or 3 people got out, like it turned out it was millions that flew back and forth to New York and the Northwest as well. But the way it can spread rapidly, and that was that curve that we were all looking at, that was exponential growth far above our capacity to take care of people. And if you looked at it carefully, you saw 2 things. One is, as people got the illness, there was a certain expectation of immunity that would follow. The other thing I would point out is the curve never went to 0. When they talked about flattening the curve, there was never any scenario where this disease would just give up and go away. That's not going to happen. It's too contagious compared to MERS or the original SARS back some years ago. So it's not going to go away. The exposure and the incidence is not going to go to 0. We can flatten the curve and keep flattening it. That will gradually build up some people with some immunity. Now, if that immunity ends up lasting 2 or 3 years, then over time we might get to 40, 50, 60% of the population that have it, which is one of the I've been told, one of the, I won't call it a magic number, but a level at which this becomes very manageable. Or maybe the secondary time you get it, it's more like a rhinovirus or something, to where you have a cold, which some coronaviruses do just cause cold symptoms. So there are other coronaviruses out there, and that's what they do. They cause a very mild illness. That's why this novel coronavirus was so unusual, and its transmission process was so dangerous. So I think there's a chance for herd immunity. It won't be anytime soon. I'm probably less optimistic than some that a vaccine is around the corner. I hate to pin everything on that. Leads me back to that final section I talked about on policies. If indeed there is no, hopefully number one, hopefully the mortality rate is much lower than we first worried about, the 2, 4, or 6% or 10% that we worried about from the WHO early on. It may be, if the New York study is right, that it's significantly below 1%. And if you take out the people 69 and under, it may be that it's right around seasonal flu mortality rate. So we're looking at that. We'd like to see people get immunity. A vaccine would be great. We do need to know the real mortality rate and compare it to other things that we're willing to do things, whether it's travel for a mountain or beach trip with our family. We take a certain risk every time we do that of getting in a car, even though we've all read about a family who's died in an accident. We kind of weigh as Americans or as adults or both that there's certain risks that we're willing to take. We think the advantages outweigh the disadvantages. And so I think we can plug those in to our policy decisions, try to, number one, get people back to work, but get them back to living their lives, getting our kids educated. As silly as a prom sounds, that's an important thing to a lot of people that has been missed. But certainly the education, I know I've talked with a first grade teacher the other day, trying to do that over a video chat, room full. There's so much more that a first grade teacher brings to that classroom than what can be transmitted in a two-dimensional picture like this. So I'm looking forward to us gradually getting back, using the best science we can, being cautious with, at the same point, being reasonable, and recognizing there's multiple values that we hold dear, and that I think we can make some good decisions. I'm glad to hear from everyone. Certainly, I know there's a wide range of opinions, but that's my job to represent. So I hope to hear from people, and I'll do the best I can on my end.
Okay. So one more question, Dr. Newton, if you could. Are the symptoms and the times of the quarantines, are those still holding from, those were developed a while ago? I mean, is it still 14 days? Do you see that changing at all? Are the symptoms still predominantly what we've heard throughout this period?
Well, the symptoms, yes, are still generally, really, we call it an ILI, which is an influenza-like illness. There's a certain amount, there's some similarities and some differences, but certainly it can start as an upper respiratory infection. Obviously, that's the way the exposure generally starts. And in many people, that's where it ends. It's not much more than, feels like a little bit of a sinus infection, maybe a low-grade fever, maybe a mild cough. But in the ones that's going to be bad in, it can go down into the lower respiratory tract, and that's where it can cause signs of type of pneumonia with a deeper cough. Obviously, those are spreading. The fever is pretty common in the illness. There are, as we've seen from the serology or antibody studies, the controlled tests up in New York, there's a lot of people that really didn't remember having any symptoms, so may have been exposed without that. I think those are similar. The symptoms are largely that. I do think in the original quarantine time, and that's probably still a good safe bet. I wouldn't overrule the CDC. Originally, the tests were taking 7, 8, sometimes 10 days to come back. And so we certainly didn't want anybody to even think about going back before their test was back. And then it's almost like you started over on day 10, hadn't had any symptoms for, say, 3 or 4 days. And we had a senator with something like this, hadn't had any symptoms, get the test back, it's positive. Now you have to quarantine because there is an incubation period, and then there's a disease period, and then a little bit of contagiousness that goes later. But I think we could shorten that just a little bit. I'll leave that up to people brighter than me. But I do think part of it was informed by the 7 to 10 days of waiting on a test, which was kind of like we couldn't even think about anything less than that. And so it's probably a good solid answer to stay with for now.
Okay. And then, so our last question, it's really a comment, is are you going to run for president in 2020?
I love serving this district. I love our part-time legislature where I get to be at work at 1 in the morning with a bunch of great people doing,
Yeah,
where I understand what I'm doing. When I'm sitting down one-on-one with people, I just been pretending like I've been talking to you, Sue, for the last hour or so. But
no
I
problem.
enjoy doing that. I love doing it. It's a great way to provide for a family as well and to work with great people. And I tell you, Georgia's got a good system. I think those of us who get informed in our day job, so to speak, and then take that part-time to the legislature is a uniquely, I know it's not, Georgia's not the only one, but it's a particularly important thing. I was on call with agricultural people this morning who are farmers who are out there trying to keep, these grocery stores don't just come up with the food we eat, the produce, the meat. We know they're having their struggles too. So
Yeah,
I love the
yeah,
fact that those are the people who also are on the agricultural committee to give me advice when they want to inform me on what's important to getting food to our school children, our elderly, our needy, our food banks, which are so important.
right.
Great shout out to Golden Harvest Food Bank, who's doing just a phenomenal job. Amy over there is doing great work with a huge team. Just so many people. I love the ability to serve. I look forward to doing it. We'll see what
Yeah.
happens.
Well, Dr. Newton, we can't thank you enough, not just for being here today, but obviously, for all of your leadership and all of the hats that you wear. We are a better community because of your leadership. And again, on behalf of the Chamber and all of our participants today, thank you so much for spending some time with us. If there is anything that we can do for you, we are here to serve you as well. And we hope that we will be able to shake your hand very soon.
I hope so. I'd enjoy that. Thanks for all you guys do.
Thank you.